All right, welcome back to ABA Exam Review and the continuation of our BCBA practice questions series where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out behavioranalyststudy.com for all of our study materials, including our combo pack. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. You use an A-B design to reduce self-injury and rates decrease after intervention. Insurance requests stronger proof that your intervention caused the change. You consider options such as a reversal or multiple baseline. Each has different feasibility given the setting. What should you do in this situation? So let's put ourselves in this particular scenario where you are using an A-B design to reduce self-injury and rates decrease after intervention. So first glance seems okay. We know with self-injury, there's going to be some ethical concerns with any sort of reversal design, delay design, and the rates seem to be decreasing. So it seems good. However, insurance says they want proof that your intervention caused the change. And we have to always abide by insurance rules because they're the ones that are funding us. So regardless of how you feel about your intervention, if insurance requests something, we need to follow through with that because they're the one who will approve the funding or not. You consider options such as reversal or multiple baseline, and each have different feasibility given the setting. So what should we do, right? A lot of different things at play. Intervention seems to be working, self-injury is involved, insurance needs stronger proof. We can use something like the reversal or multiple baseline. What do we think we should do in this situation? A, continue the A-B design until there's enough data to satisfy insurance requirements. The problem with this is there's not enough data, just the A-B design is never going to indicate strong functional relation or functional control because there's no reversal, right? All we did was go from baseline to intervention. So A is really not going to meet the requirements of the insurance. B, request that stakeholders and guardians write letters to insurance verifying the effectiveness of your intervention. Now you can do that, but that's still not going to be data driven. That's going to be very anecdotal and very subjective. Insurance needs that objective proof we're causing the change. C, consider switching to an A-B design if ethics allow. This would be a path to take. If ethics allow, given the self-injury, if we start reversing the intervention and showing that once the intervention is removed or put back and behavior changes accordingly, then we can provide that stronger proof. C looks pretty good. D, remove the intervention and redesign your implementation. That's one step probably too far given the fact that the rates are decreasing. So regardless of what insurance needs, self-injury is going down. So we don't want to just change this intervention that quickly. What we want to first do is still consider this reversal or multiple baseline, in this case, an A-B design, if ethics allow. In a classroom, a student blurts out answers around 15 times per class. The teacher explains that while the behavior is disruptive, she doesn't want it eliminated because the student is highly engaged and often correct. You suggest a procedure where reinforcement is delivered only if the student answers less than 3 times per class. After a week, the student continued to participate, but at a more appropriate level. The teacher asked why you chose this plan instead of reinforcing only correct answers or ignoring blurting entirely. What would you say? Long question. I never want you to see a long question and skip it or start to panic. We have to be comfortable looking at these long questions and attacking them just like we would any other question. So, what are you saying to this teacher who asked you about the plan you chose? We have a student who is blurting out answers too many times per class. The teacher says it's disruptive, but she doesn't want it eliminated. She wants it reduced. So immediately we're thinking DRL, right? With the DRL, we are reducing how often a behavior occurs, but we don't necessarily need to eliminate it. So you suggest a procedure where reinforcement is delivered 3 or less times, if the answer is 3 or less times per class. So we're going 15 times per class to 3 or less. And it's effective. The student is participating, but at a more appropriate level. So why did we choose this over just reinforcing correct answers or putting it, quote unquote, on extinction by ignoring blurting entirely? A, reinforcing every absence of blurting would likely result in no student responses, which is not the teacher's goal. Well, potentially, right? If we reinforce every absence of blurting, then the student may stop responding, but not necessarily. And we might eliminate blurting all or answering altogether, which is not what we want. So A does not seem like the best plan given what we want. B, ignoring all blurting would eventually eliminate the behavior, but would also eliminate desirable behavior. So let's think about that. If we ignore all the blurting, we're going to eliminate the behavior potentially, but we'd also eliminate the answering all together, which again may or may not be the case. C, providing punishment for blurting would reduce it faster and still maintain correct participation. That's not necessarily true. If we're providing punishment for blurting, which could be the student's answering, we might reduce the blurting altogether, but we would not necessarily be maintaining correct participation because we're not reinforcing correct participation. D, reinforcing only correct answers might still allow excessive blurting, so this plan targets the rate of responding directly. So let's think about this. If we reinforce only correct answers, blurting might still happen at an excessive pace. But with the DRL, we're looking at the rate of responding, not necessarily getting rid of it entirely, which with A, reinforcing every absence of blurting, might lead to no student responses. B, ignoring all blurting would eliminate the behavior. So both A and B is eliminating behavior entirely, but we're not describing why we chose DRL as far as keeping the desired behavior at a good rate. D, reinforces the correct answers, or reinforcing only correct answers might allow excessive blurting. But with the DRL, we're targeting the rate of responding directly and doing it systematically where we're reducing how much blurting there is, but not eliminating it entirely. Challenging question, right? Make sure we understand while A and B seem okay, D explains the plan fully. A coach gives extra water breaks when athletes finish drills quickly, but the pace of finishing drills is not improving. The coach insists water is reinforcing because everyone likes water. As the behavior analyst, how would you evaluate this statement and what would you do next? Now, as an analyst, when you say or when you hear someone say, this stimulus is reinforcing because everyone likes this stimulus, immediately, as a trained analyst, you need to question that logic. If someone were to tell you pizza is reinforcing, everyone likes pizza, a lot of people like pizza, not everyone. Water, although we need it, doesn't make it reinforcing. So just because the coach says it's reinforcing doesn't make it reinforcing. And in this case, the coach is giving water breaks for finishing drills quickly, but they're not finishing drills any faster. So the water is not reinforcing. What are we going to do next? A, question if the coach is qualified to teach the sport and report the coach to the administrator. Now, be careful when we are working with other professionals in their roles. And we have to remember they're not trained necessarily in ABA like us. They're trained in their role. This could be an excellent coach who just doesn't understand ABA principles. So A is a little too harsh. B, acknowledge that the water is not reinforcing, but continue using it as a reinforcer since water is a primary reinforcer. While true, water, given enough deprivation, is a primary reinforcer, it is not having an effect here. So it doesn't make sense, nor is it a reinforcer in this situation, given the deprivation. C, acknowledge that the pace of drills is not improving and conduct preference assessments with the players. Yes. Explain to the coach, well, yes, everyone likes water, or water is needed, I should say. Not everyone likes water. Water is needed, but it's not having an impact on the behavior. We need to actually find out what these players like and then find out what's reinforcing. D, change nothing as the drills are still being done. Well, they're being done, but the coach wants them done quicker. So it's not being done up to their standard or criterion. You're going to acknowledge the pace of the drills is not improving and conduct preference assessments with the players. 2 researchers are tracking the number of hand raises in a classroom. At first, their data are highly consistent. After several weeks, one begins recording partial raises halfway up, while the other only counts full hand raises. Agreement drops below 60%. What should you do? We have a situation where our IOA has dropped below 60%, which is low and not good enough. Two researchers were tracking number of hand raises. First, consistent, but then one is now recording something different than the other. Okay. What should you do in this situation? A, retrain both observers. Yes. Again, your job as the analyst is typically going to be training, explaining, supervising, correcting, modifying. That's going to be one of your primary roles. Okay. We're not looking to blame people for taking data incorrectly or doing things wrong. Always try to blame yourself first, as in, was my training good enough? Have I been supervising well enough? So if you see after several weeks, observation and measurement are drifting, well, it might be time to retrain. B, stop data collection until observers are collecting the same data. Well, that doesn't make much sense, right? We can't collect the same data without data collection. C, get rid of the data that don't have agreement and continue the research. Definitely not, right? If that's the data you took, that data needs to be included. And if we're removing a lot of data, then that might cause a lot of conflict within your results. So if you're supervising research or involved in research, we've got to be very careful about the data we are collecting. D, remove the observer who's not collecting data properly. Before we remove them, again, let's look at ourselves. Our training, was it good enough? Were they trained well enough? Am I supervising well enough? Always ask yourself that first. So the first thing we're going to do is try to retrain both observers. A student resists starting a lengthy essay. Before presenting the essay task, you give 3 short assignments, write their name, underline a sentence, and circle a word. After 3 successes, the student begins the essay without protest. What is this an example of? All right, let's finish with a pretty easy question. Okay, remember, the exam is long. Not every question is going to be all that difficult. Even though we always read every answer choice, in this case, this one should be pretty straightforward. We have a student who doesn't want to start a lengthy essay. So what do you do before? Well, you build momentum. Write your name. Underline a sentence. Circle a word. Now, start your essay. We're building momentum with behavior. We're getting a lot of yes, yes, yes. Starting to build behavior, starting to build that momentum up until the point where they start that essay. Are we shaping? Well, shaping involves approximations of one behavior. We've got several behaviors here. Is it positive reinforcement? We're not sure what happened after each one of these, if they were reinforced or not. And D, extinction, we're not putting anything on extinction. We're not withholding anything. What we're trying to do is simply build behavior momentum to get the student to write that essay. Thanks for watching. Check out behavioranalyststudy.com for all of our study materials. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. We'll see you soon.